All right, so let's get this party started. Let's talk about Module 1A is what we're going to call this. So let me actually get our slideshow so you can actually see it. So let's talk about people getting cared for in their home. So the objectives are going to be to understand the history of home care and home health, identify the different disciplines that are involved in home care, understanding what a nurse aide's role is in home care, and understand supervision requirements for a nurse aide. So as you go through this class, you guys, some of you are going to actually take the nurse aide class, the fundamentals of nursing, which will allow you to sit for the nurse aide, the CNA, at the end of next year. So it's going to be really important for you to understand. So let's talk about the history of home care. So throughout history, lots of family members provided health care to ailing relatives in their home. And in the U.S., the earliest documented organized effort to care for sick family members at home was in 1813 by the Ladies' Benevolent Society of Charleston, South Carolina. In the late 1800s, women were able to train as nurses, and they were hired by wealthy families. There was no real training like we see today where you go to college for 4 years, etc. It was you took a class, someone taught you, and it was handed down, and then you were able to work. The establishment of home care insurance coverage began at the turn of the century, and by the early 1900s, women were routinely doing home visits. So again, if you think about the early 1900s, nursing was a traditionally female occupation. So from 1909 to 1952, there were over 100 million insurance claims for home visits submitted to MetLife, which was the big insurance company of the time. Not quite sure what happened there. Alright, so while nurses were being trained and were becoming more utilized, professional homemakers were also being trained. In the early 1900s, mature and practical women were trained to provide child care and home management, often called housekeeping aides. In 1959, at a home care conference, it was decided that homemaker services should be extended to the chronically ill and elderly family members. At this point, the home care nurses and the homemakers had been sharing very similar duties, so they were acting the same way. In 1960, personal and home and health care duties were added to a homemaker's job description, and the term home health aide was adopted. So between 1970 and 1990, there was a large increase in the number of home health agencies opening. So Medicare and Medicaid started regulating. So just a reminder, Medicare is for the elderly, and Medicaid was actually to help tide people over, more so for the indigent population, which we all know that's not really true today. So by 2003, over 20,000 providers delivered home care services to well over 7 million people throughout the country. Home health costs each year continue to climb into the billions. So over time, the titles of the aides in the homes have changed. What's the difference? So a home health aide is the title used by home health agencies that provide skilled care, and they bill Medicare. Part of their role is the aide is to do bath and vital signs. So a home care aide, this title is used by home care agencies that do not provide skilled care, and they do not bill. So often their role is personal care, meal prep, and home management skills. Again, you guys, not sure what's going on with this thing. So why ultimately is home care growing so much and so fast? And there's a lot of reasons for this. Increased healthcare costs have created a bigger need for affordable continuing care, and it's cheaper to do it in one's home. If you think about it, you're already paying the bills for the house, the electricity, versus at the hospital, somebody has to pay those expenses. People are living longer. People with chronic diseases like Alzheimer's need care as they age. The patients are too healthy to be hospitalized, but in need of assistance, and they can't live at home alone with no help. So hospitals lose money if a patient stays longer than the allotted time for illness or treatment. Therefore, there's a push to get patients in and out of the hospital much faster than in the past. However, these patients may still need follow-up and continued care at home. So if you think about someone who was pregnant and they had a baby, a normal, healthy baby in the 1960s, the mother may stay in the hospital for 4 or 5 days. That is unheard of today. Mothers have babies and they go home the next day. So it's kind of scary. So Module 1B, let's talk about the disciplines that are involved in home care. So each home care agency is different, but all share similar methods of operation. The basic procedure for a new patient might go something like this. Initial contact is made when the patient or a family member. This could be a referral from a hospital, a church, a doctor, a family member, anybody. You could actually call and say, I think my family member needs help. Then an assessment is made, and it's completed with the prospective patient. This is to decide whether or not home health is appropriate for the patient. If the patient qualifies, types of care or services are discussed, and they are decided based upon the patient's specific need. So, for example, if you have Alzheimer's disease, you may need someone to prepare a meal so you don't forget to turn the stove off, which may be an extended amount of time versus someone who has surgery may only need someone to check on them and help them to bathe. So after you have the assessment, a care plan is individualized and designed to help the patient achieve the goals that are listed. Those goals are made by the nurse and the physician and the patient care team. It designates specific tasks that each member of the healthcare team will complete or work on with the patient. The purpose of developing and carrying out a care plan is that it gives the healthcare provider a guide for helping the patient. So it actually allows for you to do better care, faster care, and more appropriate care. Once that care plan is developed, the various personnel are then assigned for their specific type of service. And we're going to talk about that in a minute. So, with everything, records are kept, documenting everything that is done. Some patients need home care for a short period of time, while others need care on a continuing basis. And the case manager will actually determine this, and they will also be the ones to determine when termination of care needs to happen. So let's talk about the disciplines involved in home care. So home care health agencies vary in what disciplines or services they provide. Home care is often referred to as an agency that does not provide skilled disciplines. So there may not be a nurse, for example, or physical therapy or occupational therapy. The focus on the home care aide and services include personal care, and home management. So this would be someone who comes in, they cook, they do a little bit of light cleaning, they may do a little bit of light laundry, kind of like a little housekeeper, but has a little bit of medical background. The market for home care is growing, and many aides will find employment in this section. Home health is typically referred to as an agency that can bill Medicare. The focus is to provide skilled care ranging from home infusion therapy, which is what I do as my third job, wound care, which is something Miss Ta does, and a lot of education, which is something we all do. So the following is a list of possible disciplines that could be involved in a home health agency. Sorry for the coughing, you guys. So a registered nurse, an RN, has a state license to practice nursing and home care. The RN will assess, provide intervention, evaluate, and educate the patient and their family, which is a big thing. And they also provide interventions for the family. So if you have a patient who's had surgery and they have what's called a wound vac to help those wounds heal, the nurse may not be able to come every day and stay for a long amount of time, so they teach the family. Community health nurse or a public health nurse is a state licensed nurse with special knowledge pertaining to the promotion and preservation of public health. The licensed practical nurse and LPN can work under the direction of a registered nurse or a physician. LPNs are not frequently used in home care. Why do you think that would be? So the nurse aide can work under the direction of a registered nurse or a physician as well. So you can have a physical therapist, which is also a person who's licensed by the state, and they work to restore function of the body. So after a disease or an injury or loss of a body part, they actually work with families. Occupational therapists are certified and licensed by the state. They help with daily activities of living, so they're called ADLs. Respiratory therapists are also certified or licensed by the state, and they actually come in to evaluate breathing and assist with prescribed breathing treatments and equipment. And if you think back to health science too, the person who can prescribe is a physician or a nurse practitioner or a physician's assistant. Speech and language pathologists are certified by the state, and they help patients with speech disorders that are caused by physical issues or mental problems like Alzheimer's. So they can also assist with swallowing problems and other communication devices. Speech therapy is often not in each agency, so you don't have those people readily available. And then you have case management, and that can be a registered nurse, a physical therapist, the speech pathologist. It's not usually a physician. And the case manager's job is to assess the needs, develop the plan, and review the plan. They coordinate the care of all of the people we just talked about. Social workers, you guys all know what a social worker is. So they're formally educated to help families, groups of people, individuals, and sometimes communities. So they often coordinate community resources to meet a potential problem or a family's needs. They can help with long-term planning for a nursing home or advanced care directives, like if you have cancer, do you want certain treatments as you come to the end of your life? We also have chaplains, and the role of the chaplain, as you guys all can imagine, is to provide spiritual counseling and guide for the families. They do not have to have a physician's order. We also have a registered dietitian trained to teach patients and their families about certain things that would help improve their health by eating appropriately. So when you look back on Edmodo, I'm giving you guys the handouts. So take a minute and look at the role of the Home Care Aide and the team. Those are the answers to it. And then you can look at the case scenario. Not a big deal. Those are the answers. So let's talk about the nurse aide's role in home care. So the nurse aide can assist with what we call ADLs, or activities of daily living. Whoops. Maybe it'll go. There we go. So the nurse aide can assist with those ADLs, which is light house cleaning, meal preparation, grocery shopping, laundry and linen, and garbage disposal. Yes, you can take the trash out. The other things they can do is bathe, groom, dress, take people to the potty, feed them, all right? So some of the other responsibilities we talked about: light housekeeping, meal preparation, grocery shopping, taking care of the garbage. So the nurse aide may also be responsible for making sure that the patient can transfer, which move from place to place, and do some exercises that help, that have been prescribed by the physical therapist. The home care aide can never give medicine. That's not within their scope of practice. So being a nurse aide requires a certain level of flexibility and comes with lots of responsibilities. So the work hours can often be irregular, schedules can change. It's not really a Monday through Friday 8 to 5 job. People need care 24 hours a day, 7 days a week. So everything that's done in the hospital is done at home. So while there's many things that a nurse aide can do, there's also a lot of things that the nurse aide cannot do. So nurse aides can't administer medication. They can't remove tubes. They can't remove objects. And they can't accept an assignment that's outside of their scope of practice. And as we go through this, you'll actually learn what that means. So supervision of the nurse aide. Nurse aide supervisors have lots of responsibilities. They have to make sure that Medicare is involved so that we get paid. Continuing education happens. So as a nurse, I have to have 30 hours of continuing education every year to maintain my license with what's the very last thing on the bottom, which is the North Carolina Board of Nursing. Alright, so another role of the nurse aide supervisor is to ensure that all the criteria for employees is being met. They also want to see that the nurse aide in the patient's home while providing that care, so they will actually come in and watch you. You always work under the supervision of the nurse or some other professional higher than the nurse, like a physician, a nurse practitioner, if it's appropriate. Supervision occurs at all times, not just when the supervisor is in the home. So as a nurse, if you're my nurse aide and you're in someone's home, I am ultimately responsible for everything that you do. So if you go and look at handout 3, which is in that module 1A package, it shows you some of the things that the nurse aide can and cannot do. So the supervisor of the nurse aide is also responsible for delegation of tasks. So if I ask you to do something, then I'm ultimately responsible as the supervisor to ensure that it gets done. So every agency has their own procedures and rules for how often a nurse aide needs supervision and in what capacity. It's the responsibility of the agency to know their supervision requirements, and it's the responsibility of the nurse aide to comply with those responsibilities. Almost done, guys, if the computer will act right. So if you go and look, there's lots of home care agencies in our community. Duke has one. There's Liberty. There's all kinds in the community, and you as a patient actually have a choice. So because you're getting paid, the agency gets paid for the care that you give. They want to provide the best care. So for more information on supervising a nurse aide, you can actually go and look at OSHA. You can also go look at the North Carolina Board of Nursing, or you can look at the Department of Health Service Regulation. All right, so I'm going to get you to answer your blog question.